Introduction. Smoking is a common habit that affects millions of people worldwide. However, smoking is not just harmful to your lungs and heart, it can also have serious consequences for your sexual health. In this video, we will discuss the effects of smoking on sexual health in both men and women. We will also explore the scientific evidence linking smoking to sexual dysfunction, fertility problems, and reproductive health issues. By understanding the harmful effects of smoking on sex, we can take steps to protect our sexual health and well-being. 2. Smoking and sexual function. Smoking can have a negative impact on sexual function in both men and women. The chemicals in tobacco smoke can damage the blood vessels, nerves, and hormones that are important for sexual function. Scientific studies have shown that smoking is a major risk factor for sexual dysfunction, including erectile dysfunction and reduced libido in men, and sexual arousal and orgasm problems in women. If you smoke and are experiencing sexual dysfunction, quitting smoking can help improve your sexual function and overall health. 3. Smoking and fertility. Smoking can also have a negative impact on fertility in both men and women. The chemicals in tobacco smoke can damage the reproductive system and affect fertility hormones. Studies have shown that smoking is associated with reduced fertility in both men and women. For men, smoking can lead to reduced sperm count, poor sperm motility, and abnormal sperm shape. For women, smoking can lead to irregular menstrual cycles and decreased ovarian function. If you are trying to conceive, quitting smoking can help improve your fertility and increase your chances of a healthy pregnancy. 4. Smoking and reproductive health. Smoking can also have serious consequences for reproductive health. Smoking during pregnancy can increase the risk of complications such as preterm birth, low birth weight, and stillbirth. It can also increase the risk of birth defects and developmental problems. Smoking can also increase the risk of reproductive cancers, such as cervical and ovarian cancer in women, and testicular and prostate cancer in men. If you are pregnant or planning to have children, quitting smoking is one of the most important things you can do to protect your reproductive health and the health of your child. The benefits of quitting smoking. Quitting smoking can have numerous benefits for sexual health, fertility, and reproductive health. Within just a few weeks of quitting smoking, blood flow and oxygen levels improve, which can help improve sexual function. Quitting smoking can also improve fertility and increase the chances of a healthy pregnancy. Women who quit smoking before pregnancy have a lower risk of complications, while men who quit smoking can improve their sperm quality and quantity. By quitting smoking, you can also reduce your risk of reproductive cancers and other health problems. Conclusion. Smoking is a major threat to sexual health, fertility, and reproductive health. By understanding the harmful effects of smoking on sex, we can take steps to protect our health and well-being. Quitting smoking is the best thing you can do for your sexual health, fertility, and overall health. If you are a smoker, talk to your healthcare provider about quitting smoking and explore the resources available to help you quit.